Ambrose Igwekamma Ezeh was elected the 16th National Chairman of the Association of Community Pharmacists of Nigeria, ACPN, in a fiercely contested election held on July 26, 2024, during the association's 43rd Annual National Scientific Conference, Oluyole 2024, in Ibadan, Oyo State. At the time of his election, he made bold promises to reposition community pharmacy practice, strengthen members' welfare, deepen advocacy, and transform the profession. 2 years on, his administration has not only fulfilled those promises, but has surpassed them in virtually every ramification, setting a new benchmark for visionary leadership within the association. Over the past 2 years, Pharm Ambrose Igwekamma Ezeh has transformed community pharmacy practice in Nigeria through bold reforms driven by innovation, capacity building, strategic advocacy, grassroots healthcare, and global engagement. Born on October 1, 1976 in Afa, Enugu State, Ezeh is a graduate of the University of Nigeria, Nsukka, with a master's degree in public health from the Lagos University Teaching Hospital and additional leadership training at the University of Washington. Before becoming the 16th National Chairman of the Association of Community Pharmacists of Nigeria, ACPN, he served the association in several strategic leadership positions, laying a solid foundation for the transformative reforms that have defined his administration. One of the defining features of his administration has been the digitization of community pharmacy practice, championing technology-driven initiatives that have modernized professional practice, improved communication, strengthened service delivery, and positioned community pharmacists for the evolving healthcare landscape. Firmly committed to the welfare of members, Pharm Ezeh also established the ACPN Welfare Fund, creating a sustainable platform through which members can access financial support whenever the need arises. This initiative has significantly strengthened social protection within the association and reflects his unwavering belief that the welfare of members must remain a top priority. His leadership has focused on expanding access to healthcare, advancing advocacy for local pharmaceutical manufacturing, promoting community pharmacies as primary healthcare centers and integral partners in the National Health Insurance Scheme, while intensifying the fight against substandard and falsified medicines. Under his watch, community pharmacists have gained greater national visibility through strategic media engagement, reinforcing their role as frontline healthcare providers. Among his landmark achievements is the establishment and institutionalization of the Community Pharmacists Assessment and Career Progression Institute, CPACPI, the world's first structured career progression framework for community pharmacists, which has earned international recognition. His administration also pioneered the first ever monthly capacity building program for community pharmacists, creating a consistent platform for continuous professional development and knowledge sharing. His administration successfully organized high-level engagement meetings with the Registrar of the Pharmacy Council of Nigeria, PCN, and members of the Council's National Executive Committee on Pharmacy Inspection, PIC, activities, and the prevailing practice environment across the country, during which ACPN presented a comprehensive charter of demands aimed at improving professional practice and patient care. Recognizing the need for stronger regulatory collaboration, the ACPN leadership also held a strategic engagement meeting with the Director General of the National Agency for Food and Drug Administration and Control, NAFDAC, and her management team over the prolonged challenges surrounding orphan and service drugs. The meeting yielded a commitment by the agency to review and restructure existing regulatory provisions to improve access to these essential medicines. In further strengthening institutional leadership, the administration enrolled members of the ACPN National Executive Committee in executive leadership and management training programs at the University of Washington, equipping the association's leadership with global best practices in governance, strategic management, and organizational development. Beyond these, the administration recorded several landmark advocacy victories that have reshaped community pharmacy practice in Nigeria, while consistently engaging government to establish a more secure and regulated pharmaceutical supply chain. Ezeh's administration intensified advocacy for increased government patronage and investment in locally manufactured medicines, promoting medicine security, industrial growth, and national self-sufficiency in pharmaceutical production. It also led sustained engagements with the federal government, the National Assembly, and relevant stakeholders for the full integration of community pharmacists into primary health care delivery and the National Health Insurance Authority, NHIA, ensuring that Nigerians have improved access to quality pharmaceutical care. The association remained at the forefront of the campaign against substandard and falsified medicines through strategic collaborations with regulatory agencies, public enlightenment campaigns, and stronger enforcement advocacy aimed at protecting public health. Under his leadership, ACPN continued to advocate for improved practice environments for community pharmacists, fair remuneration, better regulatory policies, and enhanced professional welfare, while providing evidence-based policy recommendations to government on key national health issues. The administration also strengthened the association's voice in national healthcare policy by actively participating in major health sector reforms, stakeholder consultations, and policy dialogues, ensuring that community pharmacists remain central to healthcare planning and implementation in Nigeria. In addition, the administration strengthened youth anti-drug advocacy through the National Anti-Drug Abuse Competition, NADAC, promoted internship and mentorship opportunities for young pharmacists, positioned Nigerian community pharmacy prominently at the FIP World Congress through international collaborations, and established a modern pharmacare center in Umuawulu, Anambra State, thereby expanding access to quality pharmaceutical care in underserved communities. In recognition of his exceptional contributions to healthcare development and community service, Pharm Ezeh was honored with the prestigious chieftaincy title Nnatubelugo of Umuawulu Kingdom, Anambra State. In just 2 years, Pharm Ambrose Igwekamma Ezeh has not only fulfilled the electoral promises he made to community pharmacists, but has exceeded expectations, delivering unprecedented reforms, strengthening institutions, improving members' welfare, expanding professional opportunities, and elevating the status of community pharmacy practice both nationally and globally. As leadership expert John C. Maxwell aptly stated, "The best leaders help people with more than their jobs. They help them to become better people, not just better workers." Indeed, the administration of Pharm Ambrose Igwekamma Ezeh personifies this philosophy through its people-centered leadership, transformative vision, and enduring impact on the pharmacy profession. Ladies and gentlemen, I present to you a symbol of visionary leadership and enduring excellence in the pharmacy profession, a capacity builder, an innovator, a leader par excellence, a trailblazer, a bulldozer of positive change, and an achiever whose legacy has made Nigeria's community pharmacy career progression model a benchmark for the world. Today, pharmacist Ambrose Igwekamma Ezeh, MAW, DC Pharm, National Chairman of the Association of Community Pharmacists of Nigeria, ACPN.